Hi, my name is Dr. Svan Hilo. I'm the head of male infertility at the Mayo Clinic in Rochester, Minnesota. In this Mayo Clinic Men's Health Moment, I'll discuss a varicocele, which is a common cause of male infertility or testicular pain. I hope that you'll find this video useful. A varicocele is an enlargement of the veins to the testicle. It's similar to a varicose vein that you might see in your leg, and it's sometimes referred to as a bag of worms because it has that appearance on the outside of the scrotal skin. Symptoms of a varicocele include the following: low sperm production or decreased sperm quality, a decrease in the size of the testicle, decrease in testosterone production, and lastly, testicular pain and/or swelling. Varicoceles present in 15 to 20% of all men, but up to 70% of men with infertility may have a varicocele on exam. Reasons to fix a varicocele include a varicocele that your doctor can feel on exam and at least one of the following criteria: pain due to the varicocele, abnormal semen analysis, which would be an abnormality in either the concentration or motility, how well that sperm moves, difficulty getting your partner pregnant, even though your partner has had a negative workup and there's no obvious cause for infertility on her end, and lastly, adolescents and young men who are not actively trying to conceive, but who have a significant decrease in testicular size compared to the normal side may also want to consider having the varicocele repaired. Most men with a varicocele don't have pain, but for those who do, they may describe it as varying from sharp to a dull discomfort, increases with standing or physical exertion, especially over long periods of time, typically worsens throughout the course of the day, and will get better with lying down. The procedure to repair varicocele is referred to as microsurgical varicocelectomy. It's a 60-minute procedure. It can be performed in the office with numbing medication and nitrous gas, the medication that you get at the dentist's office to help relax you, or oral medication, which can help relax you. Or it can be performed in the operating room under general anesthesia. For patients who are concerned about cost or coverage by their insurance, it's typically most cost-effective to perform it in the office. The billing code to check with your insurance is listed here. Either way, it's an outpatient procedure. You can plan on going home the same day. During the procedure, what we'll do is we'll make a small opening in the groin area, just below where they typically perform hernia repairs. We will locate the cord that goes to the testicle, pull this up to the skin surface, and then bring in an operating microscope so that we can see all of the structures within the cord. We'll then clip and cut all of the veins within the spermatic cord, leaving the arteries intact. To do this, we'll use an ultrasound machine to help locate the artery. Success rates for microsurgical varicocelectomy are quite good. They vary from 90 to 99%. Semen quality improves in the majority of men. The amount of improvement you can expect depends on some of your baseline semen parameters. In men with extremely low sperm counts, they may have enough of an improvement that would allow them to undergo intrauterine insemination instead of in vitro fertilization. And men who were considering intrauterine insemination may be able to conceive naturally based on their improvement in sperm counts. Pregnancy rates have also been shown to improve anywhere from 33 to 66%. Compared to patients who have a varicocele that goes untreated. And the average time to improvement is anywhere from 3 to 6 months. There are some risks associated with varicocelectomy. Complications occur less than 5% of the time, but may include a wound infection, a hydrocele, which is a collection of fluid around the testicle. Typically, this doesn't require any further surgery unless it significantly bothers the patient because of its size or if it's causing enough pressure that it causes pain. persistence or recurrence of the varicocele, very rarely disruption in blood flow to the testicle, and lastly, also very rare is chronic pain of the testicle. Alternatives to microsurgical varicocelectomy include the following: laparoscopic varicocelectomy, which is done by locating the vein that goes to the testicle much higher up inside the abdomen. The problem with this procedure is that recurrence rates are typically much higher, up to 15%. And percutaneous embolization, which is a procedure that's performed by interventional radiology. They essentially access the veins in that area through the groin and then use coils to block the veins. But 20% of the time, or up to 20% of the time, they're unable to locate the correct veins. And the recurrence rate is also quite high with this procedure, 15%, versus less than 5% with the microsurgical varicocelectomy. It also requires a highly skilled interventional radiologist who's performed this procedure before, which is uncommon. And it may be recommended for patients who are presenting with a recurrence after varicocele repair. This may be a better option. After the procedure, you can expect the following. All the sutures on the skin are dissolvable, so you will not need to return to have any sutures removed. You can remove your dressing within 24 hours and resume showering. Most men can get back to work within 48 hours. We would ask that you avoid heavy lifting greater than 10 pounds or strenuous physical activity for about 4 weeks. And it should be okay to resume intercourse within a week. If your surgery was done for fertility reasons, we'd ask that you repeat a semen analysis in 3 to 6 months to see if there's any improvement. Thanks for watching this Mayo Clinic Men's Health Moment on varicocele. If you're interested in making an appointment to be seen, please call the number provided on your screen or go to mayoclinic.org. Thanks for watching.